Our patient who is younger than 60 and never had a thrombotic episode is the patient with a low risk for thrombosis among the PV population of the patients. And our patient was properly started on therapy with a low-dose aspirin, 81 milligrams, and a phlebotomy as a mean to decrease the hematocrit below 45%. Now, a few months later, the patient is back in our office with continuous requirement for phlebotomies and continuous presence of general symptoms, which will be reflective of uncontrolled red blood cell count, or in other words, uncontrolled polycythemia vera. One needs to remember that we are talking about the person, not just about controlling a number. We control the number to decrease the risk of thrombosis, to save the life of the patients, but also to improve the quality of life. So it's a control of the thrombotic risk, and the goal, the secondary goal of therapy for polycythemia vera is control the symptoms. This patient is still symptomatic from the polycythemia vera, despite the phlebotomies. In that case, it is very reasonable to say that something else needs to be done. If the phlebotomies are not controlling the symptoms, the control of the blood cell count does not project into improvement in quality of life, then one needs to think about introduction of a cytoreductive therapy. Cytoreductive therapy means the therapy that would control the blood cell count without allowing the blood cell count to go up and down. Basically, phlebotomy is introduced when the number is high. Then you lower it, then it goes up, then you lower it with phlebotomies, so it goes up and down, up and down. And the symptoms obviously are not very well controlled if you allow time periods where the blood cell count is high. Cytoreductive therapy will level it off and make the number low all the time. That was highly likely result in a better control of the symptoms. So in our particular case, although the patient has a low risk for thrombosis, it is reasonable to introduce cytoreductive therapy, and that would be hydroxyurea as the first line.